This short video from Precision Analytical is intended to assist you as you collect your samples for your dried urine test for comprehensive hormones. So you should have received a Dutch collection kit from your provider that should have instructions in it, as well as 5 collection devices, plastic bag for those to be returned in once they're dried, a requisition form to complete, and then a return envelope that everything can come back to our lab in, as well as a payment card for those of you that will be paying the lab directly. It is very important that all of the information that we're requesting that you provide us with so that we can give your provider as complete of information as possible. So that includes the requisition form as well as the collection devices themselves. So we have 2 different styles. The older style is a sticker that will go directly on the collection devices as you hang them up, and we just want to make sure that you have your last name, your first name, and all that sample information on there. The newer style, the back of the collection device is going to ask you for your last name and first name or just initial, and then when did you collect the sample. What day of the cycle is obviously only for females and only if you're actually cycling, and then the time. We want to fill all of that out, and then there are 5 different samples, and we go ahead and circle which sample you're actually collecting at a given time so that that's always very clear. The collection devices themselves, the newer style, are a matchbook style, so they're folded up, and then as you unfold them, you'll see this filter paper. That is what you are going to be saturating with urine. So you can either urinate directly on the filter paper, or you can urinate in a cup and just dip it for 4 or 5 seconds. We just need it to be completely saturated with urine, and then it's going to sit in this orientation as it dries. It may rest on this bottom middle piece as it dries. That's perfectly acceptable. So you just want to leave it open to dry for at least 24 hours. If it doesn't seem like it's quite dry, you can go ahead and leave it for 8 hours, 12 hours more. They're stable for several weeks once they're dried, but it's very important that they do dry all the way before you send them back. The older style, again, the label is a sticker, and so you're going to go ahead and put that on the collection devices as you collect them, and you can just hang them to dry on a towel rack or a counter edge or whatever's convenient. And these are the times that are set to collect the samples. We want one around dinner time, bedtime, right when you wake up, and then 2 hours later. So the collection instructions look like this, and they're going to lead you through that. So just some specific instructions to know. If you're a big coffee drinker or a tea drinker, we don't want to be having caffeine as you're collecting the test. So if you have a hard time giving it up, restrict it as much as you can, maybe 1 cup the morning that you start, and if you can handle none, then go ahead and just do without while you're doing the collection, because that's really ideal. But as you hit lunchtime and you head towards that first dinner time collection, we want to keep the fluid intake minimum or moderate really until the 2 hours before the collection. So with lunch, go ahead and have something to drink, but don't overdo it. And then as you hit about 3 o'clock, 4 o'clock, you're going to want to have a good 2-hour stretch with no fluids at all, and then you're going to collect that sample. Usually right before dinner is ideal, around 5 p.m. And those can be somewhat approximate. And then at bedtime, same thing. Have something to drink with your dinner, but then the 2 hours before the sample, you want to restrict that. If you're drinking alcohol during that time period, maybe 1 drink at the most, because if you overdo that, it can affect some of your hormones a little bit, but one glass of wine or something like that is not going to be a problem. You're collecting again right when you wake up. This sample, the timing is really important. Right when you wake up and you get up for the day, some of your hormones start to change a little bit, and the timing of that is some of what we're revealing in this test. So you don't want to lay around in bed and watch television for half an hour or something like that. When you're ready to get up for the day, just get up and collect that sample. You might want to set a timer for 2 hours because we want that next sample to be as close as possible to 2 hours later, and if you can't go at that time, then go ahead and just drink a little bit of fluids and go as soon as you're able. But between these 2 samples, you want to keep the fluid intake to about 1 cup per 100 pounds of body weight. Go ahead and eat breakfast as normal, but we want to keep the fluids to somewhat of a minimum over that time period. The 5th collection device may or may not be used. So if you happen to wake in the middle of the night, then you want to go ahead and collect that sample. So we don't want to disturb your sleep, so you might want to prepare that before you go to bed. Go ahead and label one for that. If you don't end up using it, that's okay, but leave it accessible so that you can get up, disturb your sleep as little as possible, and then go ahead and return to sleep until you collect that next sample. If you happen to wake up a second time to urinate and it's not your wake up time yet, then go ahead and urinate, but you don't need to collect that sample. Now, a lot of you are going to be taking hormones while you're collecting, and oftentimes the reason of testing is to monitor those hormones. So we want to be very careful about how we do that. We have instructions for that, and we'd like you to follow that, but always follow the instructions of your provider. If they have any different instructions, go ahead and do whatever they're asking you to do. The hormones you take in the morning, on that second day where you have that 2-hour period between collections, it's important that you not take hormones over that time period unless you're specifically instructed to do so by your provider. So again, we've got the 4 collections that we're taking, and maybe 5, and then the hormone schedule is here on the right. So first thing, if you take oral estrogen, like estradiol or estriol or Premarin, or if you take oral DHEA or oral testosterone, please don't take it on the day of the test. Meaning, if you're starting your sample collection around dinner time, that morning and that entire day, and until you're done with the collection, we don't want to be taking any of those products. If you're taking pregnenolone, either orally or sublingually, we don't want to take it that day either, but you're best to skip it an additional day, particularly if your doses are higher than 5 or 10 milligrams. You want to skip that for a couple of days because it can interfere with progesterone analysis. Now, if you're taking hormone creams and gels, unless your provider instructs you to, there's no reason to skip those. Just go ahead and take them at the times that you would normally take them, but ideal would be in the early to late morning on that first day, and then as we hit bedtime, for that sample number 2, if you're taking hormones around that time, around bedtime, collect the sample first and then take your hormones. So if you're putting on some sort of cream or gel around bedtime, collect your sample first, set it out to dry, and then take your hormones. Specifically, if you're taking oral progesterone, that is not on this list of hormones that we're skipping if we're taking it orally. This is a really good way to monitor oral progesterone, but it's standardized such that the expectation is that you take it at bedtime while you're collecting the sample. So if you normally take it in the morning, you can go ahead and do that in the morning, but if you take it at bedtime, and especially if you take it one day and not the other day, go ahead and take it the day of the test because that's what it's standardized for. Now, on day 2, again, you're going to wake up and you're going to collect a sample right when you wake up. And then that 2-hour period, we want to skip all the hormones and all the medications that you can. The obvious exception to that is for health reasons. If you need to take some sort of medication, please don't skip those things that are essential. But for your hormones, go ahead and wait until after that 2-hour sample unless your provider specifically instructs you otherwise. Some extras here at the bottom. If you're taking things like prednisone, dexamethasone, things that are called glucocorticoids, you want to probably check with your provider. Some of those can suppress your cortisol. Sometimes the doctor may want you to stay on that to see if it's suppressing your cortisol. Sometimes they may want to wait until you've been off of it for a while so that it doesn't interfere. So you need to check with them. If you're taking patches, pellets, or injections. So let's say a patch. If you put it on every 8 days, take it on around day 4. Take the collection on around day 4. So right in between the 2 doses. Now, if you're taking sublingual hormones, so that means I'm putting it under my tongue, I'm putting it in my gums, between my cheek and my gums, that sort of a thing, so that it's absorbing in the mouth, that's a little bit of a tricky situation. If that's the case, go to the website, go to the video library, and find the video on sublingual hormone in terms of collection, and watch that, and you can make a decision with your provider on what's best. And that's also true, and there's a separate video, if you're taking oral cortisol. So a lot of times it's called hydrocortisone, Cortef. There are different names, but if you're taking cortisol orally or sublingually also, please go and watch the video on that because there are a couple different approaches, and depending on your scenario and what your provider is looking for, you need to think through that with your provider before you do the test. So you also need to make sure you tell us what you're doing. What did you take? When did you take it last? So if your last collection is 2 hours in the morning after that waking sample, prior to that, when was the last time you took it? Was it at bedtime? Was it the morning before? It's important for us to know that information, and then it's most important that we know how did you take it. Oral progesterone and transdermal creams on your skin, those have completely different expectations in terms of the results, so we need to know how you took it. And then lastly, if you have any questions, talk to your healthcare provider, or you can also talk to the lab. Be sure to wash your hands before and after the collection, and then also wash your hands after you take hormones. Try as much as you can to not touch the filter paper, whether you're taking hormones or not. And then we've got to have dry samples. So it takes about 24 hours for them to dry completely. Maybe if you're in a little bit of a humid environment, you might want to give them a little bit longer, but typically 24 hours is just fine. After the 24 hours, go ahead and put them back in the plastic bags. The older style kits, each sample has its own bag, and use those. For the newer style kits, all 5 samples can just be folded back up and put in that one bag, and then go ahead and send those back by either the United States Postal Service, or you can use UPS or FedEx or DHL or whatever is your preference. If you want to speed up the turnaround time, the Postal Service usually takes about 3 or 4 days domestically, but if you want to speed that up, and sometimes it can take a couple extra days, particularly if it's coming from Canada or internationally, but feel free to use an express service if you so choose. And again, I want to repeat, all the information is necessary. Please complete that entire requisition form, especially that front page. We have to have all of that information. If you have any questions, again, you can contact your healthcare provider, or you can email us, info@precisionhormones.com, or you can call us at 503-687-2050, and we thank you very much for your business.